You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he said nobody should be wearing a loose-fitting denture. With us, we have North Carolina's go-to dentist for dental implants, Dr. Highsmith. Dr. Highsmith, welcome to the program.
Thank you. Happy to be here.
Welcome back, I should say. We've talked a lot about cosmetic dentistry with you in the past. Now, for people that don't know your dental implant part of your practice, who's the typical patient that's coming in for this?
Well, there's no typical patient because every case is unique, but the implant cases kind of fall into three categories. For example, you have someone who's missing a tooth, and they've got all their other teeth, they don't feel whole without that tooth being there, and they would like a permanent replacement for that tooth that doesn't require grinding down the adjacent teeth to put a bridge in there. And so that's a perfect candidate for a dental implant. So you can do a single implant, put a tooth on that implant, and you keep it in your mouth, you brush it and floss it, you treat it like a tooth.
Okay.
There are people that with multiple missing teeth, and you can still do the same thing. Let's say the other teeth are fine. We just want to fill in the gaps with something that's not removable.
Okay.
A common way of replacing a lot of teeth is a removable partial, and a lot of people have those. You got the little metal hooks that go around the teeth.
Yeah.
People don't like those mostly because food collects around them. They're kind of hard to chew with. After you're done eating, you have to go to the bathroom and kind of rinse it off. I mean, there are definitely some downsides to removable partials. They also tend to do bad things to the teeth that they're hooked to. And then there are people with no teeth or going to lose all their teeth. Say someone who's been wearing dentures for many years, and they're finally want to have something that's more secure than that. And so we can transition someone from a loose denture to fixed teeth that they don't take in and out. They can eat steak, they can eat nuts, they can eat carbon. Yeah, you can eat anything you want. Yeah, it's great because they don't move when you chew.
So this is definitely the hottest, newest trend in dentistry, which is replacing missing teeth with dental implants.
Yeah, well, it's definitely a hot trend. It's new to a lot of dentists, but I've been doing it for 30 years, so it's not new to me.
You say it changes people's lives.
Oh, absolutely. You can take someone from I can only eat maybe fish to eating a juicy steak. You can eat whatever you want. Your teeth don't move when you chew. And to a lot of people, that can be life-changing.
So in North Carolina, are there a lot of people wearing dentures?
Oh, gosh, yes. In Western North Carolina, where I live, there are tens of thousands of people either with dentures, missing a lot of teeth, or need dentures that are putting it off. There's the Civic Center in Asheville. You could fill that over multiple times with people with dentures or people that need dentures. There's a lot of those people out there.
So if dental implants are so good, I guess to just give them a fixed set of teeth that don't come in and out, why aren't they all doing it? Why aren't these denture wearers coming in to do it? What's your take?
Well, a couple of reasons. One, the first is they don't know. Okay, these people have dentures. They've stopped going to the dentist. So let me share with you what it was like for these people before they had the teeth. For most people that have dentures, the 10 to 20 years before they had dentures, what was their life like? Everything that the dentist did failed. They had root canals, maybe the teeth broke, they wouldn't hold fillings, teeth got loose, they got sore. They typically went to the dentist a good bit. Nothing worked. Everything failed.
That's a lot of money too.
That's a lot of money, it's a lot of time, it's a lot of trauma. And so there's a trust issue here because everything that this profession did for them didn't work. And so can you blame them for staying away? And so now they have dentures. And so for many of those people, getting their dentures was a great day because it was the end of the road for them. It was the end of those teeth that hurt, the teeth that didn't look good, because you can make a denture look quite nice, but it's still a denture. I think of a denture as kind of like a wig, where it can look okay. You can make a denture look beautiful, but it's not as functional as the real deal, the natural teeth. You can't run your fingers through a wig, or even worse, someone else can't run their fingers through your wig. And so it's just not as functional. And so chewing with a denture is not like chewing with natural teeth. Like I said earlier, the food doesn't taste the same. Your chewing is greatly diminished because you just can't bite as hard. The teeth move around a lot. The lower denture, people hate lower dentures. For example, people glue them in all the time. Now, I read a study that said that more money is spent in the United States on denture adhesives than dentures. And that tells you something, and it's usually lower dentures. People detest lower dentures. Many people can
I know a couple people wearing dentures. They never complain.
Well, they don't complain to you. You're not a dentist. Okay. They complain to me. I hear that all the time. And so if people with lower dentures just
But
cannot
they don't
stand
go
it.
to the dentist if you have false teeth because so you don't know your options.
Well,
So that's kind of your take on it.
You don't hear the options. And people, unless you see a show like this, you don't know that dental implants are out there. Now, other reasons why people don't do implants, there's fear. When people had this stuff done, when their teeth failed, when they had infected, painful teeth, they equate going to the dentist with lots of pain. Another reason they don't come in, they may have been told, they may have assumed, or may have been told by another dentist that I don't have enough bone for implants. And due to that doctor's experience, that may have been true. But there are a lot of advances in the field so that, it's actually very rare that someone cannot have dental implants.
So you haven't had to turn anybody away? Like saying, oh no, we just can't work with you.
If sometimes there are times when there's just not enough bone there. We now have grafting techniques. There are ways of building the bone up so that you can have implants. And so as far as what's in your mouth, that's not a reason not to do it. Another reason is cost or perceived cost. Let's say people think that, oh, I need an implant for every tooth and then a cap on every tooth, and they look at their dentures and they count the teeth. There's and most dentures have 28 teeth, and it's like 28 implants, 28 caps. Oh my God, that's a house. And they don't even go there. So no, it's not.
So how many you need for a whole set of teeth if everything works out?
The typical case is, say if you have to put fixed teeth, an arch of teeth on the lower teeth, and a fixed arch of teeth on the upper teeth, typically 6 implants on the upper jaw, 5 implants on the lower jaw.
And
that's
you
all
could
you need.
be in your 90s and get this done.
Yeah, age is not an issue with this. I have a patient that we're getting ready to start her case. She's 85. She's got some teeth left. They're about to go, and she's getting ready to do a full mouth of implants. We're going to make some dentures that lock onto the implants. They snap on. They don't move when she chews. And at 85, that's what she wants to do. She wants to eat and chew. She doesn't want something in the roof of her mouth. She doesn't want loose dentures.
Now you say in one afternoon their whole life could change.
Oh, absolutely. There's something that we do what's called Teeth Tomorrow. And what that is, that's a national network of dentists who are highly trained at a certain protocol using a certain lab to doing what we call full arch zirconia, which is a full arch of teeth made of a relatively new material called zirconia, which is extremely strong, very biocompatible. You can hit it with a hammer, it's not going to break.
All right.
And so what we do with that is the implants are placed, we take a mold of the implants, and then the lab works on it overnight, and then the next day we attach the teeth to the implants. So you've got the next day you have fixed teeth that go onto the implants, and you don't take them in and out even from day 2.
And these are permanent teeth?
These are permanent teeth.
So teeth tomorrow?
Teeth tomorrow.
And they can eat whatever they want? Could you bite like a carrot with your front teeth?
Once the implants are integrated, which takes a couple of months, at first it's kind of soft food, but once the implants are integrated, you can eat whatever you want. You can eat a juicy steak, you can bite off a carrot, a hard crust of bread. You can eat whatever you want. And with the zirconia material, this has been used for 5 years, and the number of teeth that have chipped is 0. And so you're not going to break this stuff.
They look real? Do they look real?
Oh, they look beautiful. That's the reson that I'm working with this lab. Is they've seen some zirconia cases out there.
You're a cosmetic dentist, also.
Yeah, I want them to look. I want them to look beautiful, and that's why I'm working with this group and with this lab, because they meet the standards that I've set for my cosmetic work. And so this lab does beautiful work. And so the gums look like gums, the teeth look like teeth. They look beautiful, and they last a long time. Let me show you an example.
All right.
Okay. Now, this lady came in, and I mentioned an example of a type of patient they know the teeth need to go, but they're putting it off because they don't want dentures.
All right.
So this is what her teeth look like to begin with, and there's her smile.
Oh my goodness.
Yeah, and so
that's got to be unusual.
No, I wish it were, but no, this is not uncommon at all. But you don't see it because the people that, she's smiling there because I made her. But most of the time when these people are out in public, they've learned to color their lip when they smile, so that they don't show that. But she doesn't want dentures, so she's been putting it off, which is not uncommon at all because people know what dentures are like.
So what did you do for her?
Well, in one afternoon we took those teeth out and placed the implants. I mean, you can imagine how those teeth hurt when she chewed. There's an infection going on, which we now know is not good for your heart. So with the teeth removed, implants are placed, and then she walks out that day with a full arch of teeth that she can smile with. She does not take in and out, and look at the difference between the smile between before and after.
Totally different. Totally different.
It looks like that. Then it looks like that the next day. Now, when it's all done, when she holds up that mirror and looks in the mirror and gives herself a big smile, like it's a big day. It's a wow experience, and there's a lot of happy tears because going from what she had before to a beautiful smile and the teeth stay in and they don't come in and out, and she's a happy camper.
I mean, that's what people want, right? Teeth that don't come in and out.
Yeah. Who wants removable body parts?
You could do it fairly quickly.
Next day.
Okay.
Yeah.
Okay, good.
Yeah,
what else you got? You brought a lot of photos.
Okay. This is a good example of a gentleman where the teeth needed to go.
Oh my goodness.
Just like the other lady. Look at his smile. This man is a sales rep, and he was very reluctant to go call on new customers with a smile like that. And so he was holding him back professionally as well as personally, as well as not being healthy, being uncomfortable, hurts when he chews. But he really was concerned about upper and lower dentures, and he wanted to avoid that. And so he'd been putting it off, which is really, really common. So what are his options? One option was a denture, or upper and lower dentures, and he already knew that he didn't want to do that. So what we did for him was we did an upper denture. So on the lower, we gave him a full arch of teeth that snaps onto the implants, and it doesn't move when he chews. And that solves the problem that people have with lower dentures of it flopping around and food getting underneath it and being painful. And so he doesn't have that problem. And they look a lot better. Take a look at see what he looks like now.
He looks like a totally different guy.
Oh, he is. And he calls on his customers without hesitation now. He's doing much better in his job because he has much more self-confidence. And a lot of this has to do with just improving his self-confidence, which goes back to the cosmetic thing we did. It's self-confidence.
Now, you're a dentist. Of course you think the smile's important. How important is the smile in your opinion?
How important is the smile? Well, say it's been said that, say you have a supermodel, take away a front tooth, she's not a supermodel anymore.
Okay.
People with bad teeth are discriminated against. They are treated differently. Say you have somebody with dark teeth, with what may look like dirty teeth. We don't treat them the same. Even though sometimes these people, they're scrubbing them like crazy. It's not that they're not trying, but once you have a bacterial infection in there, it's hard. You just can't get rid of that with a toothbrush. And so they're not treated the same. For example, in movies, you want to make somebody look like the bad guy. You give them gray teeth or kind of crowded teeth or some gaps. Or if you want to make them look like a shyster, you might put big fake, porcelain chiclets in their mouth so they just, so they don't look trustworthy.
Or if they want to make them look poor, they give them really bad, crooked teeth.
Yeah, and I have some patients that are just incredibly intelligent, very, wonderful people with bad teeth, and they're just not treated the same. In an ideal world, that wouldn't be the case, but it is what it is. And so people are not treated the same if they don't have, a smile that they want to show.
So one afternoon.
In one afternoon, you can change that.
Is this true that people could literally, on the day of the procedure, can walk in with no teeth, walk out with full arch of upper and lower teeth?
Absolutely.
That don't come in and out?
Absolutely.
Really? Is that rare? Or that happens?
No,
in your practice?
that's more common than not, more possible than not in each case. Most of the time, we can walk out with teeth that you don't take in and out. And the technology is there. It's 2017. Let me show you another case.
Okay, all right.
This lady, she had a set of dentures made someplace else, and she had her teeth taken out, and she had a denture made, and it was immediately obvious to her that this dog ain't gonna hunt. Okay. I don't want to live like this. So she came to see me and said, what can we do? So we were able to place implants on her upper jaw, and we had fixed teeth that fit onto the implants. And so now she doesn't take her teeth out. Her lower teeth we were able to save, but on the top we were able to do fixed teeth, and she doesn't take them in and out. Now here's her after with her smile. And you can see how it fits her face. It looks much prettier. Yeah. Those are teeth that don't come in and out. Those are porcelain teeth.
She looks like she's grimacing in the before.
She's probably She's probably trying to keep the teeth from falling out. It gagged her. They're big, bulky, uncomfortable. She couldn't chew with them. She just hated them. And now she has teeth that are, the roof of her mouth is back. Food tastes better.
And how does she get them clean? So she just comes in like a regular patient now.
She sees the hygienist regularly and gets them clean. Not only do they look better, but she can eat what she wants. For example, if you can't have a nutritious diet, for example, fiber and stuff like that, a lot of that stuff is not really easy to chew. And if you have loose dentures,
so salads are tough for
salads, nuts, steaks, basically anything that's hard to chew. She can eat anything she wants. When
So she can even eat nuts,
Oh, yeah.
popcorn.
Absolutely.
It doesn't matter.
No matter. Anything you and I can eat, she can eat.
Now, what about the people? Okay, so the denture wearers, you could help, it sounds like, the most. But what about the people with bad gums? They've got bleeding gums, bad breath, loose teeth, and they are headed for dentures. Are their gums too bad to get this done?
No, not at all. Removing the teeth fixes that problem. And so that's not a reason not to do implants. In fact, those are many of the people that we do implants on. That's their situation. Severe gum disease, the teeth come out, the implants go in the bone, and the gum disease, that takes care of that. So that's
So
not
your
a problem.
gums are never too bad to do this.
No, if you have teeth, that means you've still got some bone left, and so those people are very predictable implant cases. So that's rarely a problem.
So with the denture wearers, if a patient goes to your practice, maybe they're headed to dentures, all their teeth have to be extracted, or they're already wearing a denture. What are their options when it comes to dental implants?
Okay. Well, all the options are, first, many people do like 2 implants, an implant here, an implant here, just kind of snap it in and reduce the need for adhesive. I've done that before, but I haven't done that probably in maybe 2 decades or so. The problem with that is you think of a stool and you lean back on the stool. You've got 2 points, it rocks. And so the denture lifts up in the back, lifts down the front, and it's just, it's better than nothing, but not a whole lot.
So you don't like them?
I don't like, people don't like them. Also, the maintenance is greater as it's rocking, the little attachments wear a lot faster. It's much better if you have enough implants on the lower so it's kind of around a curve, so it's more stable. If you get, say, 4 to 5 implants in this area with snaps, then you lock the denture down and it stays in place. It doesn't rock, it doesn't have that tipping effect that you get on 2 implants. And so
What can you eat with that?
anything you want. At that point, the squeaky wheel gets the grease. And upper and lower dentures, the lower is always the squeaky wheel. Once we nail down the lower dentures and lock the lower teeth in, then the upper denture becomes the squeaky wheel, because now the upper denture is like, oh, it's a denture too.
Feels loose.
And so it's not unusual that we'll do lower implants on somebody and they love that, and now they come back in and we do implants on the upper and lock it in. Now, as far as options, the locking of the denture, that's not a bad way of going. I've done a bunch of those and they work fine. What people would really like is where they never take their teeth out. The teeth are attached to the implants, they don't take them in and out. I can take them out if I need to, if we need to do something with the implant up underneath, but on a day-to-day basis, they leave it in and they don't take it in and out. A difference for many people is maintenance. Some people are high maintenance, some people don't want to do anything. Some people don't want to clean in around the teeth. And for those people, the snap in is a piece of cake, because cleaning around those snaps, you just take some baking soda and toothbrush, rub over the post, you're done. It's a very simple thing. If they don't mind taking the teeth in and out.
All right.
But what most people, they feel more like they did before if the teeth stay in. And so the next level is like a 3rd set of teeth, the teeth that don't come in and out. That's what really everybody wants. They want to have what they had when they were young. Their own teeth, they don't take them in and out. They go and have, surgery or something like that. The anesthesiologist, now take your teeth out, and they say, oh, they don't come out. People love saying that.
So all of these patients obviously are numbed up, but you give them oral sedation.
Right. Because think back to the trust thing, because all the stuff that all the issues they've had with dentists before they had the teeth, they had a lot of negative experiences. So there's a lot of anxiety here. So we'll give them an oral sedative. Sometimes just to get a good night's sleep the night before, we'll give them a pill the night before so they can sleep. And they come in, and about an hour ahead of time, they take a couple of pills, and then they're kind of woozy and a little drunk. They're not asleep, but what happens is we do the procedure. What everybody does, they go home and they sleep for a couple hours, and when they wake up, they kind of like, well, I kind of remember bits and pieces of that procedure. And so that's the usual case where there's some amnesia with it, so they usually don't remember everything that happened. Many people don't even remember walking in the door, but they're...
So they just wake up and they look in the mirror and they've got teeth.
They go home and sleep a couple hours and wake up and they got teeth, which is nice.
How soon can they eat after the procedure, after the final procedure?
Let's say with the teeth tomorrow, say they've got the teeth put in, you've got teeth that don't come in and out. You still need to be chewing soft things for a couple of months while the implants are integrating.
How soon can they eat after the procedure?
Oh, they can eat that day. But you have to be careful at first, but before long, they're eating whatever they want. So it's a lot quicker
Do
than
you
you
hear
think.
food stories, by the way, ever, where they call and say, Doc, are you sure I could eat this soon? Or are you sure
yeah.
I could eat a steak?
Oh yeah.
We have time for a few more photos.
Oh, great. This lady came in. She'd been a friend of the family for a long time. When our son was born, she worked in the hospital, and she showed us how to change his diapers for the first time.
Okay.
And so she had an upper denture that she always hated. Also, she had some severe TMJ problems. In the picture, you might be able to see that she's wearing a lower.
What is that lower thing? Looks a
it's
little
kind
yellow
of a
or
little
something.
grayish. It's an orthotic, which basically you fit on the lower teeth to correct a TMJ problem. And so she's been wearing that for a good while. And so we placed implants on her upper and made an upper set of teeth that lock onto the implants. And we fixed the bite on it by putting some new porcelain on the lower teeth and fixed the bite on the upper one in the proper jaw position so that her jaws didn't hurt when she opened her mouth. So her main thing right now is that she has a full arch of teeth that locks onto the implants. They don't come out when she smiles and laughs, which she does a lot of. And she can eat anything she wants. And she's got the roof of her mouth back, and the food tastes the way it used to. And so...
Is this the happiest, because you do a lot of cosmetic dentistry, but would you say the people that you give their teeth back with dental implants, is that the happiest group of patients? Is it a tie?
It's a tie. It's a different type of happy. But being able to eat what you want to eat, being able to eat what you couldn't eat before is life-changing. You go into a restaurant and you order on the menu what you want to eat rather than what you think you can chew. So you get the steak rather than the fish. Let's say you go to a wedding. If eating in public is a problem for you, you might go to the wedding, but you don't go to the reception because there's food.
You don't want to eat in front of people.
Yeah, it's embarrassing to eat in front of people if you can't chew. It takes forever. You may have to go and rinse them off, and it's just not a lot of fun. And say you're hanging out with your friends and they decide you want to go to dinner, you'll think of some excuse, oh, I got to go feed the cat or whatever, so that I don't have to go and eat in public, because it's embarrassing for people with loose dentures.
Wow.
Because it takes them a long time, they can't eat much, it's not a pleasant experience. Eating should be fun.
But isn't it true if you've been wearing dentures for like 20 years, it's too late for you? You don't have enough bone to get this done.
It used to be because of the experience of the doctor who told you that. B, the imaging technology used to do a two-dimensional panoramic x-ray, which didn't really show what you had to work with. Now we use CAT scans where it's three-dimensional, we can really see what kind of bone is there. And C, there's much better bone grafting techniques. Let's say there really is no bone there, which doesn't happen very often, but it can happen. There are ways now where the bone can be rebuilt and grafted so that there's enough bone to hold on to the implants. You got to have something.
So just about everybody can do this.
Yes, I mean it's extremely rare that someone just say, hey, sorry, we can't help you.
But if 93-year-olds are doing this, then 75 is probably pretty young. To get this done.
Yeah, and also say you're, because people say this all the time. Well, I'm too old for this, and there might be 70 or 80 or so. A lot of times those people are going to be alive for a long time. And if you're going to do this, you want to do it basically the younger you are, then the healthier you are to do it, but also the more time you have to enjoy the benefits of eating what you want to eat.
So people really are embarrassed. They'll tell you they're embarrassed to eat in front of their friends?
Oh, yeah.
If you have a denture?
Oh, yeah. We hear that all the time.
Are you going to wipe it out in your town, do you think, someday?
I'm trying.
No more loose dentures.
You don't have to. You have a choice. You don't have to have a loose denture. And so it's my job to let people know what their options are.
Okay, good. You have time for a couple more. What else do we have?
Okay. Now, not everybody needs to lose all their teeth. This gentleman came in, and his primary thing was he didn't like the way his teeth look. But he was also missing a couple of teeth in the back, which is why we're talking about it around the implants. And so a lot of times how the teeth go downhill is you're missing a couple of teeth, and then you're overloading the other teeth and beating them up, and then you start to lose those, and it kind of spirals downward. And so getting all your teeth in there so that you're firing on all cylinders, you can chew better, and it takes the load off the other teeth.
So what did you do for him?
So for him, we did porcelain on his teeth to improve the appearance of his teeth, improved his bite, and we also filled in the gaps with dental implants so that he has a full arch of teeth on both sides. There are no spaces in there. Now he can chew on both sides.
Nice.
He's just chewing on one side. So he loves his smile. He has a lot more self-confidence, and his chewing, he can eat anything he wants, but he eat on either side. And so it takes the load off the other teeth so that he's going to have his teeth the rest of his life. I saved the best for last because this is my former office manager. He's missing a lot of teeth.
Oh my goodness.
And that's a lot of, he was heading for dentures.
This is common.
Oh, this is very common. When you're missing this many teeth, you put a lot of pressure on the teeth that are remaining, and it's not long before you end up with a denture. And so what we're able to do is replace the missing teeth with implants that don't come in and out, and we clean things up, put porcelain on his other teeth, and so now he has a full mouth of porcelain teeth.
Very nice.
He can smile, he can eat whatever he wants to eat, and he loves to eat.
Okay.
So, and now he's not going to have a denture, which is the idea. And so it's not just all or none. It's not either teeth or implants. Sometimes it's a combination, and we can keep teeth wherever we can, but protect those teeth by having the implants take the load so that you can eat whatever you want to eat and get the mouth back to where it used to be.
So you say there's tens of thousands of people, like within an hour of your practice, that are wearing an upper lower denture.
Easily.
And we are out of time, but your final message to these people is, come in, get them locked into something.
Yeah.
Right?
If you don't
or get
like
teeth that don't come in and out.
If you don't like what you have, do something about it, because you can.
Because dating must be tough. You know, people date into their 70s and 80s. They're on Match.com. And if you're wearing a denture, that's got to be tough.
Yeah. Which date do you tell someone you're wearing dentures? So
On the 5th date.
Oh, is that it?
You tell. So
they
really,
have a secret. I mean, you're usually not going to tell them.
So there are married couples. I think you told me people that have been married many years and they're convinced their spouse doesn't even know they have dentures.
Absolutely, or at least they never will let them see them without their teeth. You know, I have a lot of women patients who husband has never seen them with their teeth out, and so then they have to be a little creative in their cleaning and time, stuff like that, as far as to take care of them. But you know, they wouldn't be caught dead without their teeth in.
So I want to thank you for coming on the show. Final message though to somebody that's afraid of the dentist. Maybe they're wearing a loose-fitting denture. Maybe they think they're too old, or maybe they think their gums are too bad. But no matter what, these people hate their dentures or they're headed to dentures. What do you say to them as a final message?
I'd invite them in. Let's talk about their options, and it's usually easier than you think it's going to be. And we have options for giving you teeth that don't come in and out.
How soon, like if somebody comes in today, they do a consultation, you do an exam, how soon before you could tell them, we can do this?
We can tell you that day. You know, we can tell everything we need to know. We can take a CAT scan that day, because I have one in the office, and we can let you know that day what your options are.
Okay. Now we should also mention, I guess how it's normally done, correct me if I'm wrong, across the country, is you go to one doctor that does the surgery. Then you go to another doctor that puts the teeth on top, and maybe another doctor that, or somewhere that has imaging.
Right.
You do it all right there.
Yes, absolutely. And so we don't have to put, you don't have to merge a bunch of people's schedules. We can do it all right there. And with my cosmetic trainings, we begin with the end in mind, so we know exactly where we're going. And it is more convenient. You don't have to run all over town to get this done. But also, I'm in control of both parts. I put the implants where I want to restore them, and so then I put the teeth on top. And so if I'm in control of everything, everything works better. There's no trying to communicate back and forth, and so I want you to put it, no, that's not right. I want them over here. And so there's none of that going on.
So it's all done right there.
It's all done right there.
We're out of time. I want to thank you for coming on the show.
Okay, pleasure to be here.
You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.